Are you paying attention yet?
Well, Simon, today the Ministry of Health added another death to its COVID-19 recording, but also said it was a case subject to a police investigation that's ongoing. Now, One News understands that this is in relation to Operation Metals, a homicide investigation launched after a man named Robert Hart sustained serious gunshot injuries outside a Newland motel last week, and he died despite first aid attempts. Now, since his death, health authorities say he tested positive for COVID-19, and One News understands that several people are also isolating. So then you have to ask how someone who sustained these types of injuries and then died ends up as part of our COVID-19 death tally. Now, the Ministry of Health says that's because under the World Health Organization guidelines, anyone who dies while also having an acute COVID-19 infection is recorded as part of a nation's death tally, whatever the cause of death might be. Now,
So what you just saw there was part of an Operation Metals there in New Zealand, investigating the death of a man named Robert Hart, who was killed by gunshot, believably by 3 suspects, one of which 2 men, 37, 31 respectively, and 1 female suspect at the age of 20. And despite the fact that this was a gun homicide, he is still being counted as a COVID death, simply because by the World Health Organization standard, anyone who dies while testing positive of COVID-19 will be added to the death tally of COVID deaths. So if you ever wonder how, for instance, Hopkins University gets to their 5 million people worldwide died from or of coronavirus, and or 700,000 here in the United States and growing, that is how they're getting to their number. Which gotta make you think that that number, when they quote 5 million worldwide and or 700,000 plus here in the United States, it's gotta be suspect. Not that that's every case, not that that's even half, but that is part of the number, which should be disturbing. This is not an isolated incident, by the way. Let's not forget that this is how a lot of places around the world were treating liberally how they were classifying COVID deaths. For instance, there was an infamous story that leaked, well, not so much leaked, but the New York Times let fly under the radar how out of 10,000 recorded deaths in New York City during 1 month time period, more than 37% of those deaths were never even tested for COVID-19 whatsoever, yet still ruled COVID deaths because of suspected symptoms. Let's not also forget that this exact scenario also happened in the Bronx, New York during the start of the pandemic. A man by the name of Roberto Cardona, age 55, no symptoms, but got the phone call that he tested positive in the lab. And because the fear of the virus at that time was like a death sentence, it was like the equivalent of getting AIDS and or HIV, he decided to commit suicide by cop, grabbed a long gun and a machete, called the cops on themselves, charged at the cops, and they shot him up about 7 times. He dies a few days later from said injuries, which was listed as a COVID death. Or not to mention the famous case in Florida last year, where in their attempt to show how this is a virus that can affect any and all people, regardless of your age, they reported that a 21-year-old had also died of the coronavirus, when I believe it was Fox 35 News reporter decided to follow up on that story to see if whether or not if the 21-year-old victim had any underlying conditions that may have aided in his death. It was then, only then, was it discovered that he died in a motorcycle accident, but was again counted as part of the COVID death. So when they quote those numbers to you, you gotta be like, So that's my video. Let me know what you think in the comment section below. Please don't forget to subscribe to my channel. Your subscriptions go a long way with allowing me to create more content. And don't forget to like this video, share this video. This is Bruce the Boss, and I'm out. Peace.